Hello, and welcome to our companion video to our poster assessing the educational impact of nationwide VHA, DoD, MHS oncology forums. Expert perspectives on incorporating BTK inhibitors into best clinical practices for CLL. This activity is provided by Rush University Medical Center, Plexus Communications, the CLL Society, and the Association of VA Hematology Oncology, AVAHO.
Clinicians at the Veterans Administration facilities, Department of Defense medical centers, and the military hospital system facilities face additional challenges when treating patients with CLL, as veterans often present with variable socioeconomic status, increased age and comorbidity burden, as well as a substantially higher exposure to traditional carcinogens, which modifies not only their baseline risk for developing CLL, but may also contribute to disease stage at presentation. Fortunately, recent advances in therapeutic options have contributed to improved outcomes for patients with CLL. While the introduction of first and second generation BTK inhibitors into the clinic have provided additional effective treatment options for patients with CLL, synthesizing new trial data can be challenging for the busy clinician in the VHA, DoD, MHS setting, thus impeding the clinician's ability to incorporate these agents into treatment plans for patients with CLL. In addition, since patients are often overwhelmed when discussing the available treatment options with their care providers, veterans with CLL would benefit from patient-centric education focused on the use of BTK inhibitors for the treatment of CLL, so they are better equipped to make informed decisions with their care providers. The objective for this program was to assess the educational impact on confidence, knowledge, and competency after participation in a 1-hour CE activity on the use of BTK inhibitors for the treatment of CLL conducted in the VHA, DoD, MHS setting. Topics covered included mechanisms of action and pharmacologic differences of BTK inhibitors, considerations involved in selecting and incorporating BTK inhibitors into clinical practice, and BTK-related side effects and their management.
This educational initiative includes 3 components. In collaboration with the CLL Society and the Association of VA Hematology Oncology, VHA Oncology Clinical Forums is a series of 30 live or virtual 1-hour accredited meetings conducted in partnership with hematology oncology departments in the VHA, DoD, and MHS between November 2019 and December 2020. Activities are presented by nationally recognized experts in CLL and take place during tumor boards, cancer conferences, and other hematology oncology department specific meetings in VA medical centers, DoD hospitals, and MHS facilities nationwide. If a live in-person meeting is not possible due to COVID-19, a live virtual presentation on an online platform is made available. This live meeting series included integrated polling and an audience response system was included to capture educational measures. Our poster results include pre, post, and evaluation data collected from 21 out of the 30 live meetings to assess confidence levels and knowledge and competency gains among VHA oncology clinicians. Additionally, patient education materials were provided at each of the live meetings by the CLL Society. The second component was an on-demand and during activity. The data for this activity is not shown. The third component is a patient education webinar. Through a collaboration between Plexus, Rush, and the CLL Society, this activity consists of a live virtual webinar presented by an expert in CLL. The webinar provides CLL patients within the VA, DoD, and MHS with up-to-date information on the clinical use of BTK inhibitors for the treatment of CLL and to equip these patients with the appropriate knowledge to make informed decisions with their care providers. This component also includes a patient presentation from Bruce Wright, a patient advisor and patient educator for the CLL Society, who is also a veteran with CLL. The activity is archived and promoted to VA clinicians at each of the live meetings to share with their patients. To date, 386 attendees have participated in the live or virtual meeting series. 647 learners have participated on the online and during activity, and 64 joined the live patient webinar. Total participation for the live meeting series is 386 healthcare providers treating patients in the VHA. The This was 21 out of the 30 live meetings. 55% of the live meeting series attendees are hem-onc physicians, 15% oncology nurses, and 13% were NPs and PAs. The potential impact of this activity is approximately 2,123 patients with CLL seen in the VHA per month. This is an average of 5.5 CLL patients seen per month in the VHA.
95% of participants agreed or strongly agreed that the program was effective for learning, and 85% agreed or strongly agreed that the knowledge and/or skills acquired from this activity were directly applicable to their professional practice. 79% of participants in the live or virtual meeting series indicated an intent to change practice after participating, particularly related to understanding and application of BTK inhibitors. 78% indicated that they have a strategy or strategies to make changes in their professional practice based on the knowledge and/or skills acquired from this activity. Participation in this program improved VHA, DoD, MHS clinician confidence and their ability to differentiate among BTK inhibitors used to treat CLL. Clinician knowledge was improved regarding recent key findings from Phase 3 clinical trials and recent FDA approvals of BTK inhibitors for the treatment of CLL. Participants exhibited clear displays of competency in selecting and incorporating first-line and second-line BTK inhibitors into clinical practice, as well as employing necessary management strategies to ensure optimal patient outcomes. The majority of patients in the patient education webinar found the program to be very informative, and all participants felt that their knowledge was somewhat or significantly improved. Plexus will continue to promote the archived patient webinar during the remaining live VHA Oncology clinical forums so VA providers can share with their patients. Overall, these interim findings demonstrate that this national series of live virtual educational intervention is effective and provided gains in confidence, knowledge, and competency, and intent to change practices among clinicians in the VHA, DoD, MHS system who treat patients with CLL. However, 78% of clinician participants feel additional education in this area is warranted. With an increased understanding of BTK inhibitors for the treatment of CLL, both clinicians and patients will be better prepared to select the optimal therapy for improved individualized care, as well as properly utilize the prescribed therapy, which in turn may lead to improved outcomes in veterans in the VHA, DoD, MHS facilities.